Jonathan sleeps well, but we can't get him to eat anything but hot dogs and crackers. Now Larry gobbles down everything and doesn't know when to stop.
I would like to introduce our guest, Mr. Andrews. After raising their three birth children, he and his wife are now fostering twins.
Well, let me start off by saying the twins came to us quite unexpectedly. An agency contacted us to see if we were interested in helping our grandnephews, Larry and Jonathan. The boys are 4 years old, and they'd been removed from my niece's home.
That is such a difficult decision and a major interruption of your daily life.
The only other option was for the boys to go to foster care, and my wife wouldn't hear of that. Story goes that the boys were severely abused by our niece's second husband. That's their stepfather. He seemed to favor Jonathan, but if either one of them misbehaved or did anything the stepfather didn't like, he'd put Larry in scalding hot water in the shower to punish him, even for what Jonathan had done.
The stepfather used Larry as the scapegoat?
I get angry just thinking about it. Believe me, I'm reminded about it all the time. Just today, I turned on the shower for myself, and when Larry walked by the bathroom, he started screaming. When it comes to bathing him, he won't go near the tub. I can only give him a sponge bath using a washcloth in front of our kitchen sink. He requires special medical care for the burns on his feet and legs, and doctor explained he'll need skin grafts in the future.
Sounds like the boys experienced significant abuse. Could you tell me a bit more about how they're developing?
As for Larry, he still isn't toilet trained. He doesn't like a bathroom, period. Sometimes when he's alone in his room, he'll smear feces on himself and the surroundings. Jonathan, he sleeps well, but we can't get him to eat anything but hot dogs and crackers. Larry gobbles down everything and doesn't know when to stop. If we don't stop him, he'll eat till he throws up. Also, Larry has terrible screaming nightmares.
How are their speech and language skills?
The boys are behind other kids in speaking. They mostly speak 2 words at a time, although Jonathan has said some full sentences. My hearing isn't as good as it was, so I do have a hard time understanding what they're saying.
Are they social with others?
Larry withdraws when others are around. He's really shy. Jonathan, he'll play with others, but when the play doesn't go his way, it goes sour. He bites and he hits other kids, including Larry. I take him to the side and tell him that that doesn't make friends.
How much time are they around other kids? Do they attend a preschool?
They've just started preschool through our local early intervention program. We're very thankful for that. Already they're both starting to talk more, and they're showing more interest in the other kids and in toys. Before, both boys would just pick up a toy and they'd hold it for a while and then they'd drop it. Other times, they'd throw the toy or bang it against the wall, so I was constantly trying to stop them.
In summary, both boys have experienced severe abuse and neglect and are showing delays in all developmental domains, as well as problem behaviors. For example, smearing of feces is a major red flag for a possible serious mental health disorder. Larry may meet criteria for post-traumatic stress disorder, or PTSD, and both boys may have attachment issues. Both boys may have cognitive delays as well, but we won't know that until they have participated longer in a structured preschool program. And finally, they also have ongoing health issues with eating and sleeping.
With our time constraints, we can't go too deeply into helping the Andrews family, but do you have some suggestions on how they can help the boys?
Both boys need further assessment and ongoing mental health services from a professional experienced in children who have suffered abuse and neglect. They also need to continue early intervention services. If they're not receiving speech and language therapy now, I recommend they be referred for those services. And finally, the boys need a comprehensive assessment of their cognitive development once they have participated in structured preschool services for several months. In addition, the Andrews likely need more information about the issues these children face. They will need support and validation from all providers for the challenges they've assumed in caring for the twins.
The boys also need to be evaluated by a primary healthcare provider who can assist with their eating and sleeping problems and also monitor their growth.
I want to thank Mr. Andrews for sharing the family's story, for their willingness to take in the twins, and their efforts to meet the children's needs. Development of school-age children. Dr. Nickel and Betsy, would you please start by reviewing the typical developmental characteristics of a school-age child?
I'd be happy to. Children in this age group practice, refine, and master complex gross and fine motor and perceptual motor skills. Their drawings are more sophisticated, and many participate in sports and play a musical instrument. They have improved in their use of grammar and syntax, can describe experiences in detail, and talk about thoughts and feelings. Cognitively, the child is now a more logical, rational thinker. Children in this age group are also able to sustain attention for difficult tasks and show improving executive function skills in their ability to plan and organize schoolwork. A school-age child also has refined his ability to understand the perspectives of others.
Socially, school-age children strengthen relationships outside the family. They participate in peer group activities and begin to experience peer pressure. The school-age child has a better understanding of social rules and adopts age-appropriate social roles.
I know a lot of exciting emotional development happens in this age group. Can you explain?
Emotionally, the school-age child is industrious and engages in purposeful activities, demonstrates goal-directed projects, and is confident and self-directed. He will develop a sense of being an individual, with both likes and dislikes and special interests. The child's self-esteem is largely built on how he perceives or views his own ability to do things.
And finally, school-age kids understand the function of money and the concept of time. They use cell phones and develop computer skills. Unfortunately, their understanding of money and time frequently does not apply to texting and cell phone usage.
Now I'll review some of the potential effects of maltreatment on the development of school-age children. It's important to realize that many children who enter a new foster home during the school-age years have experienced neglect or abuse as younger children and may have been in previous foster or adoptive settings that have not worked out. Just as typical development is cumulative, so are the effects of abuse and neglect and the lack of a stable and nurturing home environment.
School-age children who have experienced neglect or abuse may have had little opportunity to develop more complex motor skills. They may not have participated in sports or even had a bicycle to ride. Any delays in motor skills are usually due to lack of experience or lack of the chance to practice those skills. In addition, school-age children may have more difficulty with visual motor or perceptual motor skills, or how the eyes, hands, and brain work together.
School-age children who continue to show speech and language problems likely have a significant speech and language disorder and will need ongoing therapy. They may also have cognitive problems. Some of the most common problems are difficulty sustaining attention or concentrating, planning, and organizing. These are called executive function skills and are very important for schoolwork. For example, children with executive function problems have difficulty organizing materials for a project, planning each step of the project, finishing, and remembering to put things away when they are done. It's also worth mentioning that children who have experienced neglect and abuse often have both parents who have learning problems or ADHD. Therefore, some of these children's problems with cognitive skills may be inherited.
School-age children who have experienced neglect or abuse are at high risk for a number of problems with social and emotional development. They may have low self-esteem and may have few skills in initiating and maintaining friendships. They may be very sensitive to peer expectations for performance and withdraw from social contact, or they may respond by being surly and aggressive. These children may not engage in any productive, goal-directed activity, and they are at risk for inappropriate behaviors such as lying, stealing, and bullying.
At this time, we need to move on to the story of our fourth child. I'd like to introduce Ms. Peterson, who will describe her experience with Abby, her 9-year-old foster daughter whom she plans to adopt. Ms. Peterson, how long has Abby been living with you?
She and I have been living together for nearly 2 years. I love her dearly and I'm trying to stay with me. It's like she's testing me.
Tell me more about her behavior at home.
At home, Abby frequently cries. Almost always it's when I ask her to do something or confront her with something she's done. Sometimes I think she does it to avoid having to do things or talk about things. For example, last week I found some of my earrings in her pocket. After she denied taking them, I said, "These earrings didn't get there on their own." She wouldn't respond and broke into tears. She just doesn't seem to want to follow my rules. She will lie and steal, and when I confront her, she acts surprised and denies taking the item and cries. I know I'm complaining a lot, but she can also be very sweet. One time I was really sick, and Abby, bless her heart, brought me a bowl of Cheerios and a chocolate chip cookie for dinner.
How does she do at school?
Well, there are problems there too. She's behind other kids in her class and needs special help in the resource room. Her teacher says she doesn't take an interest in school. She says it's because Abby has low self-esteem. Abby has trouble finishing her work at school and then at home can't sit down for more than a few minutes to try to get her homework done. I think it's because it's hard for her, or maybe she just can't pay attention. And she doesn't seem to have any friends. She should be in 4th grade, but when she came to live with me, she had to repeat 2nd grade. This year she'll finish 3rd grade, but she's still reading and doing numbers at the 1st grade level. Now we have her on an IEP, an individualized educational plan.
I'm glad she's receiving services through an IEP. Keep giving her lots of praise for her work. Although she doesn't appear to be responding to praise and attention, it doesn't mean she doesn't hear it and feel good about it. This is common for a maltreated child. How is she socially with her peers?
The teacher says that Abby prefers to play with younger children on the playground. A lot of the kids her age make fun of her. She doesn't seem to know how to talk to them.
How does she get along socially with other adults in her life?
Oh, strange you'd ask that. Typically, she doesn't talk about her feelings. But recently, she told her caseworker that she didn't like her very much.
That might be a good thing. It could be a sign that she is getting more comfortable with expressing her inner feelings. Does she have any health problems, like with sleeping?
Abby will stay up late watching TV or playing on the computer and then have trouble falling asleep. Sometimes she's not asleep till after 11, and then she has to get up at 6:30 to get ready for school and catch the bus. She sometimes will take a nap right after getting home from school in the afternoon.
Can you tell me more about Abby physically? How much does she weigh?
I am worried about this. Last month we measured her at the doctor's office. She only weighed 52 pounds. She's also sensitive about her walking. She's very pigeon-toed. She doesn't really trip, but the other kids tease her.
On her learning problems, but I wonder if she may have problems with inattention. It also sounds like she may have difficulty with other executive functions. We need to treat her sleep problems first, since being sleepy contributes to poor attention. She's not getting enough sleep for a 9-year-old. Once her sleep is improved, she can be evaluated for inattention and other executive function problems. Her PCP needs to be careful in evaluating her for inattention, since anxiety can cause apparent attention problems. I also think a social skills group at school would be very helpful. This would give Abby a chance to practice social skills in a small group with an experienced adult. Perhaps she would make some friends in the group.
And there are lots of issues related to her social and emotional development that need to be addressed. She needs to continue seeing a mental health professional, hopefully someone with whom she can develop a positive relationship. Issues related to her anxiety need to be sorted out, and the family needs to participate in counseling